Hey everyone, today we're going to talk about C. diff colitis. C. diff is interesting because in healthy people, it's normally inactive, but whenever you take antibiotics or other things that might kill your gut flora, it leads to an overgrowth of C. diff and enterotoxin release. High-yield history and physical exam to catch this diagnosis. Your history is going to start with usually a complaint of foul-smelling diarrhea, and this diarrhea might have blood or mucus present. It's usually going to be accompanied with cramping abdominal pain. Things you're definitely going to want to ask for and will probably be present on test questions too will be recent antibiotic use. There's also evidence that you should be asking about PPI use because decreased stomach acid might be helping the bacteria grow as well. Recent healthcare exposure is also related to C. diff colitis, and you should also be assessing for signs of ileus or toxic dilation of the colon. On physical exam, the things you're going to want to watch out for are your sepsis vital signs. You're going to also want to assess for lower abdominal tenderness, and this is especially important because you're going to have other things on your differential that you're going to want to include or rule out based on your exam, and of course, large volume watery stools, some of which they might be having while they're in the ED. The differential diagnosis for C. diff could be a tricky one because it includes medication-induced diarrhea as well. It also includes other types of infectious diarrhea or food poisonings, IBD, ischemic colitis, malabsorption syndromes, hepatitis or gallbladder pathologies, MI, or GI bleed. As always, you'll want to tailor your diagnostic tests to the differential you've created. So for these patients, we're going to want to get CBC, BMP, LFTs, lactate, and of course C. diff toxin assay and antigen assay. There's other colloquial tests you can do on the stool you're sending, including the toothpick test, which basically says if you think a toothpick will stand up in the stool sample, then it is not C. diff because the stool is too firm. Also, you can say that the stool sample you are sending should conform to the shape of the container, meaning that it's a liquid. These are kind of gross, but they actually have pretty reasonable sensitivity and specificity for C. diff. You're also going to want to get an EKG because MI is on the differential for any older patient who has abdominal pain, and that's something you can't miss and have to rule out. Then you're going to want to get a CT if you think complications are suspected. Possible CT findings include colonic wall thickening, dilation, free fluid, or air in the abdomen. Each of these things mean that you should get a surgery consult, and early surgery consults in these patients is always a good thing because these are really dangerous things that have high mortality. There are 3 different severity levels for C. diff: mild to moderate, severe, and severe with complications. To put patients into these categories, you're going to be looking at the presence of fever and how high that fever is, what the patient's white blood cell count is, what the patient's creatinine is, and if there's any complications like severe abdominal pain that's concerning for peritonitis, ileus, or concern of toxic megacolon. If a patient ends up in the mild to moderate severity level, they're going to be treated with metronidazole 500 milligrams Q8 for about 10 days. If they end up in the severe category, they're going to get oral vanc every 6 hours for 10 days, and this is where you're going to want to start bringing other teams on board like a surgery consult. Finally, severe with complications means that you have concern for an intra-abdominal problem, surgery is probably on board, and you're going to be treating with metronidazole and vanc. Management of patients with C. diff is going to start with some medication changes. You're most likely going to be stopping some antibiotics and possibly some GERD medicines. You're also going to want to maintain gut motility by avoiding medications such as loperamide. Then you're going to want to start some new antibiotics of your own based on disease severity like we discussed before. Also, consider a surgery consult if their case is bad and if they have complications like the presence of an ileus, peritonitis, or concern for toxic megacolon. Finally, what you're going to be doing mostly in the ED is giving them IV fluids because they've had a lot of diarrhea and possibly replenishing electrolytes. Almost all patients you diagnose with C. diff will get admitted. You just need to decide whether they're going to the floor or the ICU. Consider ICU admission for those who are older, have high white blood cell counts, elevated bands, and just generally have more severe looking disease. Also, those with complications should always get admitted to the ICU because these complications with C. diff colitis have really high mortality. The people that you would consider discharging are young, healthy patients, those with no past medical history, who have pretty mild disease, but you still want to include really strict return precautions, including high fever, severe pain that starts, and then no improvement over a prolonged period of time. Now for some fast facts and practice pearls about C. diff. Most patients who you'll encounter with C. diff have had antibiotics in the past 14 days. In fact, almost all patients who have been diagnosed with C. diff have used antibiotics in the past 3 months. So this is something that's true both in clinical practice and in test questions. Keep in mind, though, that antibiotics themselves can cause diarrhea. So just because a patient's taking antibiotics and having diarrhea is not enough to diagnose them with C. diff. Finally, always wash your hands thoroughly. C. diff is not killed by hand sanitizer. So this is one instance where you'll actually want to wash your hands whenever you walk out of the patient's room. These are the resources that I found helpful when making this video. If you want to learn more, I think these are a great place to start. As always, thanks for listening.